Occupational therapy is a profession dedicated to helping people across the lifespan, helping people participate in the things they want and need to do. These activities, or occupations, are the everyday tasks that give life meaning and purpose. Therapists work with individuals who have physical problems, sensory problems, cognitive problems to regain independence in all areas of life. Examples include helping a child with autism participate fully in school, participate in social situations, and assisting an older adult after a stroke to return home safely. The core goal is to promote health, well-being, and a person's ability to engage in chosen occupations, fostering accomplishment and independence. Delivering these services is a collaborative effort by a dedicated team. The team provides comprehensive, efficient care to each client. Each member has a distinct role, specific educational background, and a defined scope of practice. The occupational therapist is a highly educated healthcare professional who has earned a master's or doctoral degree in occupational therapy. They are licensed practitioners responsible for the entire occupational therapy process. This begins with comprehensive evaluations to understand a client's history, goals, challenges. Following the evaluation, the occupational therapist develops a customized intervention plan, outlining activities and strategies, and is the autonomous practitioner responsible for outcomes and the safe, ethical provision of care. The occupational therapy assistant is a skilled technical professional who works under the supervision of an occupational therapist. Occupational therapy assistants must complete an associate's degree, bachelor's degree from an accredited OTA program, and pass a national certification exam to become certified. They do not perform the initial evaluation or create the treatment plan, but they are instrumental in implementing it. Occupational therapy assistants deliver therapeutic interventions and activities designed by the occupational therapist. They are trained to observe a patient's progress, provide feedback to the supervising occupational therapist, and make suggestions for modifying activities within the established plan. Their role is hands-on and client-focused. The occupational therapy aide, sometimes called a therapy tech or a rehabilitation aide, provides supportive services within the therapy setting. Unlike occupational therapists or occupational therapy assistants, aides do not have a formal accredited education in occupational therapy and are not licensed or certified. Their training is typically on the job. They function under the direct supervision of an occupational therapist or an occupational therapy assistant. The aide's responsibilities are non-clinical and support the overall function of the therapy department. Their work allows licensed practitioners to spend more time providing skilled, hands-on care to patients, improving the efficiency and flow of the clinic. In summary, these three roles form a clear hierarchy based on education, licensure, scope of practice. The occupational therapist is the leader and planner. The occupational therapy assistant is the skilled implementer. The aide is the essential supporter. The OT's advanced degree gives them authority to evaluate and plan. The OTA's specialized training allows direct therapy services. The aide's role is to assist with non-patient-related tasks. Understanding this structure is the first step toward appreciating safe, effective occupational therapy services for clients. The core responsibilities of the occupational therapist are comprehensive and analytical. The occupational therapist is solely responsible for initiating and completing the patient evaluation, which involves interpreting the data to identify the client's strengths and the client's deficits. From this analysis, the occupational therapist develops the official intervention plan, setting long-term goals, setting short-term goals that are meaningful to the client. Furthermore, the occupational therapist is responsible for determining when a patient is ready for discharge and completing the discharge summary. Throughout the process, the occupational therapist continually analyzes patient outcomes, modifies the plan as needed, and oversees all services provided by the occupational therapy assistant, ensuring alignment with professional standards and ethical guidelines. The occupational therapy assistant takes the plan created by the occupational therapist and brings it to life. Their primary responsibility is to provide the skilled therapeutic interventions prescribed in the treatment plan, guiding a patient through exercises to improve fine motor skills, teaching adaptive strategies for dressing, teaching adaptive strategies for cooking, managing a group therapy session focused on social skills. The occupational therapy assistant is a keen observer responsible for documenting the patient's performance and response to treatment. They communicate this progress back to the supervising occupational therapist, often providing valuable insights that can inform modifications to the treatment plan. They are partners in the therapeutic process, contributing their skills to achieve the goals set by the occupational therapist. In stark contrast, The responsibilities of the occupational therapy aide are exclusively non-skilled and supportive. An aide must never provide direct patient therapy or perform any task that requires the clinical judgment or expertise of an occupational therapist or occupational therapy assistant. Their duties are centered around maintaining the therapy environment, cleaning and sanitizing equipment after use, preparing the treatment area for the next patient, managing supplies and inventory. They might also assist with transporting patients to and from the therapy gym, handling clerical tasks like filing or photocopying, and generally ensuring the clinic runs smoothly. Their work is vital for efficiency and safety, but remains firmly outside the realm of clinical intervention. The relationship between an occupational therapist or OT and an occupational therapy assistant or OTA is governed by strict supervision requirements. These rules can vary by state and by practice setting. The key rule: the OTA must always work under a licensed OT. Supervision is collaborative, built on trust and communication, to ensure safe, effective care. The OT is ultimately responsible for all services provided by the OTA, so they must ensure the OTA is competent for assigned tasks. Supervision can be direct, like co-treating a patient, or indirect, like reviewing documentation, or discussing a case over the phone. How often supervision happens depends on factors: the complexity of the patient's condition, the number and diversity of clients, the skills and experience of the OTA, and state and workplace regulations. For aides, supervision is non-clinical and can be by an OT or OTA. Let's consider a practical scenario involving a patient named Mr. Smith, who is recovering from a hip replacement. The occupational therapist, or OT, would begin the process by conducting a thorough evaluation. Assess Mr. Smith's home environment, ability to perform self-care tasks, dressing, bathing, current pain levels, personal goals for recovery. Based on this comprehensive assessment, the OT would develop a formal intervention plan. This plan would include specific goals, such as Mr. Smith being able to dress himself independently using adaptive equipment within 2 weeks. The OT is the only one qualified to perform this initial evaluation and create the legally binding plan of care. Once the plan is established, the OT can delegate specific interventions to the occupational therapy assistant, or OTA. Following the OT's plan, the OTA would work directly with Mr. Smith. The OTA might teach Mr. Smith how to use a long-handled shoehorn, a sock aide, and a reacher to get dressed without breaking his hip precautions. The OTA would guide him through the physical motions, provide encouragement, and problem-solve if Mr. Smith struggles with a particular device. After the session, the OTA would write a detailed progress note documenting what was done, how Mr. Smith responded, and any observations about his performance, which the supervising OT would later review. The occupational therapy aide would support this session in several important ways, without ever providing direct therapy. Prepare the treatment area, bring the reacher, sock aide and shoehorn, retrieve additional equipment during the session, clean and sanitize used items, and return them to storage. The aide never instructs Mr. Smith. This requires clinical skill. The OTA never changes the long-term goals without consulting the OT. This clear and respectful delegation ensures safe, efficient, and effective care. In conclusion, the occupational therapy team is a structured collaboration of professionals with distinct and complementary roles. The OT evaluates, designs plans, and oversees. The OTA implements skilled interventions under OT direction. The aide manages environment and non-clinical tasks. Clear responsibilities and supervision protect patients and uphold high standards, while communication and respect create seamless, patient-centered care.